So, what we've been talking about for almost 45 minutes is we defined supervision. We talked about the 3 pillars that are foundational: the supervisory relationship, spirit of inquiry, educational practice. You add the 3 pillars to the 4 values: integrity, ethics, diversity, science-informed practice, and you come up with the essential foundational principles for a robust model of good supervision. Now you're beginning to get a sense of why good supervision is complicated and takes a great deal of thought and planning. Now, this particular way of looking at it, this model, represents a movement away from a purely hierarchical supervision process or intervention to one that's strength-based and builds on the process of both collaborative and interpersonal growth of the supervisee and the supervisor that's established from the onset of supervision. It's not I'm the supervisor and you're the supervisee and you're going to do what I tell you, and I'm going to evaluate you on how well you copy me. You can see by looking at it within this framework and approaching it from all of those foundational types of concepts, you're setting the stage for a collaborative type of supervision, supervisee type of relationship, and how that can inform both the development of your supervisee and your development as a supervisor. Now, especially introducing the goal of self-assessment, this transforms the responsibility for evaluation from supervisor to a shared task between you and your supervisee. So you have in your head how you think they're doing. Have a supervisee also answer that. So on a regular basis, you can ask your supervisee, how do you think you're doing? What do you think you need more work on? What do you think you're particularly talented at? What do you think you need more, that you need to stop doing? What do you need to do more? However, always important to remember that even though this has become a shared collaborative task, you as a supervisor holds the power. You're the one that ultimately does the end stage evaluation, and you're the one who has the responsibility for gatekeeping. You determine whether your supervisee will progress to the next level of professional development. This can be very difficult. So one example is years ago I had a supervisee who worked with her for a year. And even though we both worked very hard, throughout the year, she was really unable to put up appropriate boundaries between herself and her clients. And so even well into the year, she would go home crying about her patients' problems. So we sat down towards the end of the year, and by talking about it and by looking at the data we collected, it was clear that in spite of our best efforts, she was going to continue to have trouble with this. She still wanted to be a psychologist. So what we talked about was her not becoming a clinical psychologist, but instead becoming one that was much more interested in research, because then she could follow protocols, she could do manualized kind of treatment, and she found that much, much easier to do. It's like, you know, you see a whole bunch of patients, you have a manualized protocol you have to go through. That was the boundary that she needed. And she went on to have a very, very good research career. But some of that came from me as a gatekeeper. I didn't think she'd be good as a clinical psychologist. Now, competency-based supervision. We need a definition here that can operationally define competence as a working process, this is a first cut, that provides a structure for establishing and monitoring ongoing supervisory practices. A working process that provides a structure for establishing and monitoring supervisory practices. How else do you know what good supervision is? Unless you know what's competent. So, one definition is that competency-based supervision is an approach that explicitly identifies the knowledge, the skills, and the values that are assembled from a clinical competency, and you're developing learning strategies and evaluation procedures. You need both, learning strategies and the evaluation procedures, to meet criterion-referenced competence standards in keeping with evidence-based practices and requirements of your local clinical setting, whatever facility you happen to be involved with. This construction of the supervisory contract is the foundation of the supervisory alliance. You working out with your supervisee how these competencies are going to be identified, defined, and assessed. Lays the groundwork. And remember, we as supervisors are the ones who are responsible for establishing the alliance and for identifying and repairing strains and ruptures. This is extremely important. As supervisors, we are the ones that are responsible for identifying and repairing strains and ruptures in the relationship with our supervisees. Sounds easy, not so easy, in my view. As supervisors, we're human beings. As human beings, we're going to enjoy some supervisors more than others, and we're going to enjoy some supervisees less than others. If there's a supervisee who's not doing badly, it's just like, for whatever reason, it's difficult and it's work to be with them. And you really don't look forward to your supervisory sessions with them. And in a way that parallels clients that we don't like, your supervisee has a tendency to cancel a lot, not show up, and it's like, you know, you're kind of glad that they didn't show up. So you tend to like blow it off. That is exactly the wrong thing to do. Because it's up to us as supervisors to know that that is a problem. And we have to have a way of catching it and doing something about it. Or let's say your supervisee really objects to being taped and showing you the tape and having you listen to it. And truth be told, you really don't want to do it because you know it's going to be a lot of work and you know it's going to really be difficult. Easy for you both to keep putting it off. That's not identifying and repairing the rupture. So be aware, and once you're aware, have a plan on how to make it different. That's your job as a supervisor. So, the best supervisory practices include cognizance of the role of personal factors and diversity in supervision and therapy, as we've talked about. Calls for the management of countertransference. And if you are not coming from a psychodynamic kind of background, it's what we were saying before. That you're still a human being, you're going to have reactions. Those reactions can affect your relationship with them. So this parallel process refers to the phenomenon where the dynamics of the therapeutic relationship stimulate and are reflected within the supervisory relationship. So let's say your supervisee, let's get back to it. You have a supervisee who's okay with anger, but they're dealing with a very, very angry client. Parallel process could be that the supervisee comes in and is extremely angry at you. How come you never told me? You don't give me enough, right? That could be a parallel process. Also important to be able to identify that and work with it. Or it could work the other way. It's a two-way street. The dynamics of the supervisory relationship can be reenacted within the supervisory relationship with the client. So I had a supervisee who was telling me about a previous supervisory experience where the supervisor wasn't really available, and when they were available, they were usually very vague about what they wanted, but they were quick to criticize. Supervisee told me that under those conditions where she didn't know what was expected, but she constantly got criticized, she tried to do as little as possible so that her supervisor wouldn't get angry at her. And she tried to do as little as possible within the context of doing therapy. So this reaction can go both ways. So you have the supervisee right in the middle of seeing their patient, so the patient and supervisee, and then the relationship between the supervisee and the supervisor. And either relationship can affect the other one. Now, specific competencies of supervision were articulated 10 years ago at the 2002 Competencies Conference. And one product of the conference was a description of supervisory competencies. This is an issue that's still being worked on, and they're establishing reliable and valid assessments of the identified competencies. The emphasis of this group is the ability to apply knowledge and skills in the real world and to use performance outcomes as criteria for evaluating supervisees and programs. Once these competencies are identified, the requisite skill, knowledge, and values are assembled, forming the identified competencies the initial focus of supervision. So I'll give you an example, because that's kind of theoretical. Bring it to the real world. Think about a first session with a client. This is going to require that your supervisee be able to demonstrate a variety of listening skills, knowledge of diagnoses, diagnostic categories, and decision trees, risk assessment, diversity, and competence in interpersonal skill. All those have to be brought to bear just within the first session. So as a supervisor, those are competencies you can identify. Now, once the competencies are defined, identification of strengths and areas that require additional work by supervisees can be mutually developed through self-assessment, observation, and feedback. So it could be that you have a supervisee who, for whatever reason, accepts first answer and doesn't probe any further. Well, that could be a problem. Yep, sometimes you have to check things out and ask more than once or in different ways. Well, that could be a specific competency that you and the supervisee come up with together for the supervisee to work on with your help and assistance. In addition to setting specific objectives, there are a number of authors who advocate specific individual assessment and collaborative goal setting.